All right, let's talk about incontinence. Pretty common issue. It affects a lot of people, especially your elderly patients, your geriatric patients. It is not a normal condition associated with aging, but geriatric patients, the older you get, the more likely you are to have some type of medical issue that causes incontinence. So, the main thing I think as a nurse perspective is like breaking down the stigma and educating our patients to let them know that this is pretty common and there are usually causes and some interventions or treatments that we can do to help them get a control over this because this is one reason why especially your older patients might seek isolation or try to stay away from normal activities and socializing, things like that, which can be detrimental to their mental health, right, their physical health, if they're too scared to go out and do things because they're going to wet their pants. So, the first type of incontinence we'll talk about is stress incontinence. This is a very common form of incontinence. Uh, Loss of urine related to increased intra abdominal pressure. So, things like laughing, sneezing, coughing, changes in position, anything where you're putting extra pressure on your abdomen and pushing on that bladder, you can have a little accident. Um, Maybe just a small leak, or maybe full on pee your pants. Some common causes are like weakened pelvic floor from pregnancy, childbirth, surgery, old age, or your muscles just atrophy over time. It's a pretty common thing you hear from women who have had babies or during pregnancy. You have some damage to that pelvic floor muscle, and so the treatments would be focused on that. Looking for the cause, and we can recommend things like Kegels, um, pelvic floor therapy. Surgery sometimes might be needed if there is some abnormality or damage from a pregnancy or childbirth or something. But strengthening that pelvic floor can definitely help these patients. So that might be something I would focus on as a nurse, educating my patient about pelvic floor strengthening activities like Kegels really um, might show up on like a test, or it's a good thing to recommend for your patients. Urge incontinence or overactive bladder. This is basically an involuntary loss of urine after you get the urge. So, like someone who can't overcome the urge, they can't hold it. They get a very little warning before they have to go. So, for whatever reason, the bladder fills, it's time for them to pee, and they got to get to a toilet right away, or typically they won't make it. This is urge incontinence. Um, so, just like a sudden onset sensation that you have to pee. Sometimes it might be a neurologic disorder. Commonly, diabetes can lead to this from nerve damage all over your body from diabetes, right? Diabetic neuropathy, but it can damage the nerves in your bladder, your urinary system. So maybe the warning signs come a little too late and they can't overcome the urge. Another common cause would be an infection, like a bladder infection, urinary tract, cystitis, nephritis, something where you're having an infection somewhere in your urinary tract that will cause more irritation to the tissues in the bladder, um, and just make you have to go really bad, really fast. So, our treatment is going to be bladder training programs to make sure that they don't fill up and they get to the toilet too late, like so going to the bathroom every so often. Can be maybe strengthening the pelvic floor too, but then medications. So if they have an infection, obviously medications would be to treat that infection. If they just have overactive bladder, not infectious, then they might be put on some medications like oxybutynin, which helps to decrease the overactive bladder spasms. Overflow incontinence. Typically, the bladder is either never fully emptied or over distended for some reason, and they'll have a constant dribble throughout the day. So they might wear pads or something and be constantly changing it, complaining of dribbling throughout the day. This patient, you might actually like assess them and palpate a distended abdomen, and that could be the cause. Like your bladder's really full, that's why you're dribbling a little bit because it's trying to empty. Maybe they don't have the sensation. There's a nerve problem. Um, the causes could be an obstruction, maybe a kidney stone or a bladder stone got lodged, and now their bladder is over distended. Some anatomical malformation where they can't empty their bladder fully. Also, nerve damage like diabetes can cause neuropathy, and maybe they're not feeling or getting the sensation, and then they're having overflow. But constant dribbling, maybe you can palpate a full bladder, or you can do a post void residual, and you still see they have a few hundred mLs of urine in their bladder even after they feel like they've fully emptied. So our interventions, our nursing interventions, we can cath these patients, empty their bladder for them. They can self-cath. We can educate them about self-cathing, everything that goes along with that. Maybe medications, especially if there's like an underlying cause, like an infection or something, or medications for bladder control, and possibly surgery if there is some type of pathophysiological problem, underlying problem. And the last one is mixed incontinence. So this is a combination of stress and urge. So it could be, a little bit of both. Like they have an increase in pressure, but then they also aren't able to overcome the urge, the sensation. They have to go really fast. So causes can be the same as either, and treatments can be the same as either. We might be looking at pelvic floor strengthening activities, maybe medications, maybe treating any underlying cause like bladder infection, urinary tract infection. But mixed incontinence is a combination of stress and urge incontinence. So, medications for urinary incontinence. One very commonly prescribed medication is oxybutynin. It's an antispasmodic, anti-bladder spasm, anticholinergic medication. Very often prescribed for incontinence. It used to be the most common medication. That's why you'll still see it a lot on your tests. Now there's some medication called sulfenicin, which is more commonly prescribed, but it's a similar medication with similar actions and side effects. And this drug is typically prescribed 2.5 to 5 milligrams 2 or 3 times a day. But I guess you can go up to 20 milligrams. You're going to use caution in older adults. So probably start them off on a low dose. Indicated for overactive bladder or urinary incontinence. Contraindications would be an obstruction, urinary obstruction, bowel obstruction, glaucoma. Make sure they don't have glaucoma. A lot of older adults have glaucoma as well. Benign prostatic hypertrophy or an overgrown prostate, GERD, and liver disease. Side effects, it's an anticholinergic, so maybe some things like tachycardia, headache, dizziness, dry mouth, constipation, blurry vision. You're going to report immediately or be on the lookout for signs and symptoms of urinary retention, dizziness, blurry vision, palpitations, confusion. You're going to watch their liver function, checking liver enzymes, things like that. But pretty commonly prescribed medication, so you should understand this med. So nursing interventions, what are we going to do as nurses? Typically, most problems when we're talking about nursing interventions, we're going to start with assessing and educating our patients. So assessing them, looking for signs and symptoms, complaints of different types of urinary incontinence problems, and then educating them to let them know that this is not a normal part of aging, but actually pretty common issue, especially in the older adult population. Understanding that there is a stigma and trying to overcome that to translate to our patients that there typically is a cause. They're not alone. This happens to a lot of people, and most of the time there are some interventions, some treatment options out there for them to hopefully alleviate some of their anxieties. And start with things like maybe just pelvic floor training, things like Kegels. We can teach them how to do that. That's something they can do on their own. They can be self-empowered. Weight loss. So being overweight puts them at a higher risk for a lot of these different types of incontinence and bladder infections. So maintaining a healthy weight, there's a ton of education we can do about, what is a healthy weight and how to maintain the healthy weight, through diet and exercise. Hydration status is very important. Some of these patients, especially if they've been struggling with incontinence, they might try to drink less so that they have to go less often. But as we know that hyperconcentrated urine is more caustic to the bladder tissue and actually increases their chances of having urinary incontinence. So maintaining, proper amount of hydration, avoiding things like caffeine or alcohol or, certain diuretics. And bladder training programs, we can institute a bladder training program, teach them how to do that. But the main thing is just educating them, letting them know that this is a common problem, and hopefully we can find some solution to make their issues better, whatever their individual issues are, and self-empower them and get them out and about and not, socially isolated because they're in fear of, peeing their pants in public or smelling like urine or whatever the problem may be. So we can do a lot as nurses to help people from peeing their pants.